Hello, everyone, and welcome to the RMBF's Self-Care Sunday. I'll be talking to you all today around nutrition, innovation, and well-being. And it's such an honor to be part of the RMBF and speak to you all today. The RMBF are such a wonderful charity that support doctors' mental health and well-being, and from someone who has struggled with poor mental health, I think it is such an amazing initiative, and it really encourages people to find a community where they feel open to talk and ask for support. So brilliant, brilliant work. And so I'm just going to start sharing my slides. And here we go. So nutrition, well-being, and medical innovation. So I'm Dr. Ally Jaffee. I'm the co-founder of Nutratank, and I'm going to tell you a little bit about the journey with Nutratank and finish off with some well-being tips. So looking at this graph, we can see that the highest risk factors for early mortality and death in England can broadly be broken down into the following. And what's at the top? Dietary risks. And we know that the Lancet has recently released a paper in the last few years showing that poor diet is the number one risk factor for early mortality and disability worldwide in both developing and developed countries. So with NICE guidelines, we have guidelines that essentially help us with our management of conditions. And when we look at these guidelines, we can see that most of the time for every chronic condition, the first line management is to offer patients diet and lifestyle advice, whether this is hypertension, high blood pressure, type 2 diabetes, polycystic ovarian syndrome, you name it, diet and lifestyle is right there at the top. So it's in the guidelines, but why is it just being paid lip service? Do we really see diet and lifestyle in action? No, we don't. So what does this mean for patients? It means missed opportunity between patient and their clinician. So patients are potentially left disempowered, not knowing what they can do to actually help themselves alleviate symptoms or prevent worse symptoms coming. And it increases the burden of lifestyle related disease on the NHS from an economic point of view. And it means that if doctors aren't actually trained in this, that they can turn to the certain, I'm not going to even finish that sentence, they can turn to a certain tabloid and find really unhelpful nutrition advice that changes from week to week, depending on what's topical and outrageous, and give that misinformed advice to patients and maybe use it on themselves as well. So that can be harmful if it's not standardized and if there's not regulation around what training doctors receive. So what is nutrition and lifestyle medicine? Nutrition and lifestyle medicine is meeting the patient where they're at, really understanding the context of their life and being able to meaningfully advise them on behavior modifications in the areas of diet, sleep hygiene, improving that, stress management, and movement, and improving social connections, these kind of things. And so what is the evidence for its use in healthcare? So here are three great studies, examples. So we know that diet and lifestyle interventions can not only prevent type 2 diabetes, but also reverse it, and can prevent poor prognosis with certain cardiovascular conditions. The Leon-Hart study was a study done in 2001 whereby healthcare professionals advised patients who'd undergone a previous MI, a heart attack, and advised patients on Mediterranean diet principles, and found that the majority of patients had reduced risk in a recurrent MI due to this advice and taking it on board. And we've also seen diet interventions being very useful in cancer patients too, as well as all other specialties. We've got the SMILES trial when it comes to depression, looking at the links between food and mood, and the evidence base is just growing and growing. So what is our vision? So my co-founder, Dr. Ian Broadley, and I formed Nutratank nearly 5 years ago now, and it's evolved into an information and innovation hub for food, nutrition, and lifestyle medicine. And we really hope to give doctors another tool in their toolbox to treat chronic conditions, to not only help their patients, but also themselves. So how do we take action to improve this situation? So we set up Nutritank, which has evolved into a network as well as a think tank. It's a network in that we wanted to start from the bottom up. And so we got onto social media like millennials do, and we found other medical students across the country. My co-founder and I were in second year at the time. And we found other medical students across the country to set up their own Nutratank branch. And we're nearly 5 years later, and we've got 2,000 UK medical schools now with Nutratank branches. And essentially the aims of these branches are twofold. One is for medical students to be able to invite expert speakers such as dietitians, registered nutritionists, or doctors with a special interest to deliver talks around diet and lifestyle interventions in certain specialties, stuff that's not in the curricula. And then the second aspect is to really learn about these diet and lifestyle interventions for their own benefit, to improve their physical and mental well-being, improve their resilience, and really get to grips with healthy habits. So we're really proud of our branches. They, in the last few years, have held over 150 events collectively, and each of them have their own Instagram. So whatever area you're in, you can check out what activity is going on at that Nutritank branch if we have a branch there. So we're a think tank in the sense that we believe very strongly in researching the problem and finding the solution through a variety of conversations and collecting data. So we published our first paper, which I'll go on to talk about, which looked at the attitudes towards nutrition and medical curricula from med students and junior doctors. And we were also invited to join the interprofessional working group that the AFN, the Association for Nutrition, were holding to improve nutrition in undergraduate curricula. And that was set up in 2019. And the GMC actually tasked that to the AFM. And so that actually I'll talk about a little bit later, but it's been very exciting this past week as we've had the curricula after 3.5 years finally launch. So what else have we done to really get this problem of lack of nutrition and medical training addressed? We've got the media's attention. So this was a great BBC article that we contributed to, talking about medical students not learning enough. And research. We've done a lot of research to really highlight the problem. So this was our first paper. It was called Time for Nutrition and Medical Education and was published in BMJ Nutrition Prevention and Health. And it looked at the attitudes of nutrition and medical education from medical students and junior doctors' point of view. And we found that the main factor, the main barrier as to why this wasn't being implemented was due to a lack of confidence rather than a lack of time. And a lot of people think it's due to a lack of time and curriculum crowding why it's not there. And we know that if people aren't confident in something, you can change that. That is a modifiable factor. You can change that through education and through training. And we worked on this paper with a whole group of people, part of the part of NEDPro, which is a nutritional think tank in Cambridge, and also some dietetic colleagues. And it really proved to us that it isn't just due to a lack of time, that it really can be resolved to further training. The next paper we published was right at the start of the first wave of the pandemic. It's called Metabolic Health and COVID-19, a call for greater medical nutrition education. There's actually a letter to the editor of The Lancet, and it was in response to an article that The Lancet put out around metabolic health and COVID-19 having associations. So we use that as a chance to really say, well, you're talking about COVID-19 and people with metabolic health issues having a worse prognosis. We really need greater nutrition education to alleviate this in the future. And finally, our most recent paper in the Royal College of Physicians Future Healthcare Journal, called Nutrition Education in Core Medical Curricula, a call to action from tomorrow's doctors. This was written by the core medical team in Nutratank, which was really exciting, a really great collaboration. And it sets out what our vision is for the future and what we think the ideal scenario looks like for how doctors should be treating patients and how they can offer diet and lifestyle interventions. So what's the impact been of our public engagement in getting the message out for more nutrition for medics? We were lucky enough to appear on Jamie and Jimmy's Friday Night Feast, having been invited by Jamie Oliver's team. And we worked with him and his public health campaigns team on the campaign Nutrition for Medics, which was an incredible experience. And then in 2019, we won the BBC Food and Farming New Talent Award, and there is our chopping board award. And it was very special. It was a really amazing achievement. And so working on this project with Jamie Oliver's team really was tremendous in the fact that we reached really big stakeholders and were able to implement a clause in the NHS long-term plan around greater nutrition education for staff and staff wellbeing. And the very exciting news on the 14th of October, so Thursday this week, just gone, we had the AFN, Undergraduate Curriculum in Nutrition for Medical Doctors, launch. And that was a hugely collaborative project, and it means that future medical students and future doctors will be equipped with nutrition skills as it's now in the actual curricula, which was a huge achievement. So further achievements, my co-founder and I are on the NHS Clinical Entrepreneurship Programme to really be able to upscale Nutratank and learn more about business and entrepreneurship and innovation. And very excitingly, in June, I was one of the recipients of the Diana Award, which comes from Princess Diana's charity, awarding young change makers for work around social change. So that was hugely rewarding. So a bit about what our online hub does. It's www.nutritank.com. And it has a lot of different functions. You can see resources and papers, and we've got a great blog section under the tab journal. And we also offer a membership, and in our membership we collate all the best evidence-based courses around nutrition and lifestyle medicine, and we have discounted rates for these courses. So you can see we've got courses from all over the world. These are the current membership benefits, and we also offer discounts to fitness platforms such as MoveGP, Hot Pod Yoga, and others. So what's next? What other current projects do we have on? Really excitingly, we're working on a project at the moment, getting medics onto farms. It might sound out of the blue, but it's actually really exciting. And the aims of the project are around nutrition for medics, and it's really getting nutrition education delivered to medics in a very practical way. So getting medics to really understand how the food system works. So going onto a farm and understanding the process of refining grains, and where, how milk's made, where other food products come from, as well as getting medics into green space for their own health and well-being. So if you're interested in this project, we're working with the amazing organisation Leaf, a leading farm education charity. If you're interested, drop us an email at the email address mentioned, and have a listen to the podcast that we did with Sheila Dillon on the food programme, explaining the background of this really exciting project. So let's talk about action. I'm very big around talking about action and not just giving things lip service. So you can see that these are our wonderful Nutratank branches and the brilliant events that they've put on, and is really about social connection a lot of the time, and meeting like-minded people and bonding over the same mission. You can see they've got some lovely nutritious snacks as well. They do a lot around self-care and social connection, and this is the St Andrews branch, going for an early morning dip and porridge, and just look how beautiful it is, moving their body first thing in the morning with that view. And this is from King's College London's Nutritank branch. One of the medical students was talking about urban gardening and how to plant your own plants from scratch, and growing your own herbs and spices. One of our other branches, Newcastle, put on this amazing cookery class. And a bit about some nutrition and lifestyle medicine work that I've done. I hope to pursue a career in psychiatry. I'm extremely passionate about mental health and very interested in the intersection between mental health and nutrition. And so I worked on a pilot project at St Charles Hospital in West London back in April, all through June. And I worked with the psychiatry team there in a psychiatric intensive care unit, so a high secure environment, working on a pilot cooking project for the patients. And it was an all-male ward. It was in a challenging environment, but wow, the huge difference it made, getting whole food from scratch to patients. And they connected so amazingly with one another over this food and with the rest of the NHS staff there. So overall, it was just a very positive project, and we had brilliant results that came out of it. And we hope to expand the project, scale it up further to other trusts. So you can see this was pasta making week I did, and it was amazing. I even had one of the patients who was soon to be discharged, so was pretty stable, in the kitchen with me, because usually the kitchen's locked because it's a high secure unit and there's utensils that could be harmful. But I had one of the patients with me under supervision, help me roll out the dough to make the fresh pasta, and he was so enthused and passionate about it, which was just very incredible to see. So coming to an end, I thought I'd finish with my top wellbeing tips. Keep it nice and simple. I think the simpler messages are, the better. So first things first, let's talk about food. It's one of my greatest passions. So eat, colour, variety, and mindfully. So in terms of colour, fruit and vegetables, just make it as colourful as possible. And for more fibre, keep the skin on. That's what I like to do, and your gut will thank you. And in terms of variety, it's really good to feed your gut a variety of different things, changing it up, using different herbs and spices, and it all is different flavors as well. And eating mindfully, so no distractions, without screens, and bonding with someone over food is an amazing thing as well. Number two, movement. I would say that we put too much emphasis on exercise, and it can cause an unnecessary pressure and lead to procrastination. It sounds too formal. Movement is such an amazing thing to be able to just incorporate in your day-to-day, walking on your commute to work, walking to the shops instead of driving, etc., etc. You can put it into your day, as well as doing movement classes, whether that's yoga or whatever it is. And three, relax and escape. This is such an important one, and something that has taken me so long to get to grips with, because I've never been great at being still. But for me, and this might be different for everyone, this can mean escaping into a really good book and just focusing solely on the book, not having other things on in the background, just focusing at one task at hand. Or for me, it's often cooking mindfully and just focusing on the food and being lost and getting into a flow state. For others, it could be having a bath, etc., etc., or meditating. And then for reflection, I think it's so important as humans that we learn from our mistakes, and that we're conscious and note things down when they're uncomfortable, note things down that you should be grateful for, note things down that have made you smile, that have made you happy. And journaling can do this very well. I love to write poetry. I find that a really great way to reflect. Everyone, can find their own outlet for this, but it's just a very important task, and something really important as doctors, as I'm sure many people know, having to do reflections on e-portfolio. And 5, community. I can't stress this enough, just how important it is. Connection is one of my foundational values, and I think when we're isolated and when we feel like there are no other humans out there that think like us, have the same interests with us, it can be very lonely. But the minute you find a community, it's just an incredible feeling. And so that could be through your gym, through your whatever you do, your art class, cooking, doctors on the ward, whoever it is. Finding community is so powerful. We're social beings after all. And 6, ask for help. I wish I'd asked for help when I was struggling mentally. I went through a big period of depression when I was halfway through medical school, and I think I would have recovered a lot faster had I asked for help sooner. And there is no shame in asking for help. So if you're struggling, ask for help. And that's about it. Thank you so much for having me, RMBF. I couldn't support your work more, and hope you've enjoyed your self-care Sunday session with me. If you want to hear more about food and mood, I really recommend these resources to hear about the intersection between nutrition and mental health. And here are our social media channels if you want to follow our work further. Thank you very much.